I was thinking about the tug of war, and I said that highlights a lot of what these families go through is that this push and pull, and to the point where they're really ready to drop that rope and no longer pull anymore. And a lot of what I talk about is it doesn't mean you stop loving the person. It means that we just have to change the strategies and look at the different lens of how we're looking through the whole situation.
Welcome to the Sober Edge podcast, inspiration for alcohol-free living. I'm your host, Terry Patterson, functional nutritionist and This Naked Mind senior coach. The Sober Edge is a place to explore the infinite possibilities on the other side of drinking. In a culture soaked in booze, discover the wonder and joy of taking a different path. Meet real people living lives of purpose and passion, learn the truth behind the alcohol myths, and get ready to be motivated, inspired, and astounded by what is possible with the Sober Edge. You're listening to episode 143 of the Sober Edge podcast. Welcome to today's episode. I want to share a little bit about what you're in store for and introduce you to my guest, Dr. Brian. So we have a powerful conversation. I often say that, but I get the privilege of interviewing so many esteemed guests with expertise. And Dr. Brian Licuanan has written a book called How to Help Your Resisting Loved One Get Into Treatment. And as you can tell from the title, it is a subject that if you have someone like 50% of American families do. If you have someone struggling with substance abuse or mental health disorders, this is a very timely conversation. And it's one that is close to my heart because I also have a close family member who still struggles with alcohol use disorder. And so I'm so grateful to have this conversation with Dr. Brian, where we touch on intervention, tough love, enabling love, boundaries, and how we can help our loved one without taking away their autonomy and, really recognizing that they have to want it for themselves. I even asked Dr. Brian a very powerful question that may resonate with one of you, and that is, what if you are the one with the substance abuse problem and your family is trying to reach out to you? How can you also receive help? So again, I think this is a very important conversation, and I'm grateful to Dr. Brian Licuanan for his work. So I'm going to read his bio, and then we'll jump right into the episode. Dr. Brian Licuanan is an author, speaker, and board-certified psychologist practicing in Southern California. He specializes in family crisis interventions as well as has extensive experience working with highly acute clients struggling with substance abuse disorders and mental health conditions. Dr. Brian is passionate about educating the public on mental health and substance addiction, and he has appeared on The Doctor Show on CBS, Dr. Drew Midday Live, Good Day LA, along with several podcasts, and has authored several studies. Additionally, his book, How to Get Your Resisting Loved One Into Treatment, a step-by-step guide for mental health and/or addiction crises, is a strategic guide to help family members with loved ones refusing help or treatment. Last, in order to maintain a sound mind and body, he trains and actively competes in Brazilian Jiu-Jitsu. Well, hey, everyone. It's Terry back with another edition of the Sober Edge podcast. And I'm very excited. And I have been looking forward to this conversation for a long time because I have a board-certified psychologist. And we are going to talk about treatment for your loved ones who might be resisting treatment. We're going to talk about some of these family dynamics that play into when someone is that you love and know and are close to is struggling with alcohol use disorder and even other substance disorders. So, Dr. Brian, welcome to the podcast.
Thank you, Terry. Thanks for having me here. Good to be here.
Yes. And so you have a book with a very captivating title, and your book is being officially released tomorrow, May 1st. So congratulations.
Thank you so much.
Tell us the title of the book.
Yes, the title of the book is How to Get Your Resisting Loved One Into Treatment, a step-by-step plan for mental health or addiction crisis.
Oh, it's so amazing. And, you and I talked a little bit before, and you have an excerpt of your book that I was able to read. But you make a great point, Dr. Brian, that this is not a book that is full of technical jargon and science. It really is coming alongside a family and helping them through these different stages of crises. So could you start maybe by telling us, like, when would a family start to feel this sort of crisis? What are those levels of crises?
Yes, yes, for sure. And if I can address that first point that you brought up in terms of my reasoning for not having a bunch of statistics or medical jargon in it is because number one, sometimes people or family members, they get inundated with all these statistics and medical terminologies and they get lost in the readings and the whole essence of the message gets lost. Not to say that those books aren't good as well, is because, but I find that a lot of my families that I work with, they get sort of intimidated by it. And so I really wanted to create something that was an easy to read, someone in early high school, even as low as 12, young as 12 years old, can be able to read and comprehend and have an idea of the concepts and the messages that are being brought forth. I also, one of the major reasons that I wanted to not have a bunch of statistics and dates in it is because I wanted to create this timeless manual or guide.
Right.
And because the reality is, whether we talk about depression, anxiety, post traumatic stress, attention deficit hyperactivity disorder, alcoholism, or substance use, 50 years from now, it's pretty much in many ways the similar presentation. Depression, isolation, feelings of sadness. 50 years from now, it's also going to be somewhat in many ways the same. What could happen is there's maybe different treatments for it. Maybe it's sometimes different treatment approaches or medicines if needed. Sometimes it presents different across people or cultures. But essentially, if you really look at the very core of these, what I call these diseases, which I'll define later, these entities that cause impairment, is they pretty much are the same. And so it's not going to change much. So I wanted someone to pick up this book 5, 10, 15, 20, 50 years from now and say it's still relevant and timely. And when you have a statistic in there and 50 years from now, 2024 is going to seem pretty ancient. And we look at other arenas, whether it be in 12-step recovery, where the big book from there is still very effective for today, that people follow it. And that was built many decades ago. And so that's kind of where I was coming from in terms of what I want to convey and the reasons behind the book, and why I left out certain things like the medical terminologies and the statistics. But back to your question is, how do we know a family's in crisis? And so one of the things definitely that I like to highlight where my book was intended for were people that were in some form of level of crisis. So crisis is some type of event or situation where a person is at a point where if they don't get help or a change happens, some very, very bad consequences, whether it be they put harm to themselves, their others, they end up in institutionalized or jail or engage in a behavior that's going to be really, really dangerous. And so it's not so much for the family members who are what I call imminent crisis. Those are people where you need to call 911 because they are about to harm themselves, harm someone else, or put themselves in grave danger. Mine were more of what I call the developing or mid-level crisis, where they're reaching that point of an imminent crisis, but it's still very urgent that if they don't get help sooner or later, something still bad can happen. And so for families, it varies. That's what I find with working a lot of families is that families define certain things in different ways. So a crisis in one family might not be a crisis for another. But typically for me, when a family can know that they're in some level of crisis, is that to understand, like, wow, if they don't make changes sooner than later, something really bad's going to happen. And some of those implications, harm to self, others, institutionalized, or create some crime that can be irreparable. And so, but that's why I work with families and kind of understanding them and what constitutes a crisis for them as well.
Yeah, that's a really good point. Thank you for that. And I really appreciate you kind of sharing the philosophy behind the book being, this timeless um, resource that we can use because it's really about the emotional, psychological, implications and how we can explore that piece. So I'm curious in the title of your book, you could have left out the word resisting,
Mhm.
right? And just had how to help your loved ones in recovery or in crises, um, and to get treatment. So why the term resisting?
Good point. And it was how to get your loved one into treatment for a very, very long time. And the word resisting came about probably about a few months prior to finalizing the draft. And I was thinking about it one day and I said, there's something. I always felt like there was something missing in the title because I was looking at from a reader's perspective, how to get your loved one to treatment. Yes, you can presume that someone needs treatment and or there's just a whole range of what that could mean to someone. But when you put that word resisting in there, I think families can really identify resisting means that it's a tug of war and we don't know what to do. And a lot of times family members feel like they're losing that tug of war. And you will, right? Especially if the family unit isn't together and have a unified vision and plan, you will lose that tug of war. And so it dawned on me one day, I said, what can I add in there? And I don't know how it manifested for me, but the word resisting came out as this great metaphor for a word because I was thinking about the tug of war. And I said that highlights a lot of what these families go through is that this push and pull and to the point where they're really ready to drop that rope and no longer pull anymore. And a lot of what I talk about is it doesn't mean you stop loving the person. It means that we just have to change the strategies and look at the different lens of how we're looking through the whole situation. So, but resisting, yes, I'm glad you highlighted that. And that's why it's even in a different color. If you see the title, it's actually a different color because I really wanted to highlight that because it really captures people when they can really realize, yes, that is what we're going through. So
Yeah, no, it's perfect. And it really does, as you said, it helps us think about it in terms of what that dynamic is. And so, Dr. Brian, what I love that you're talking about here is strategies. So, when I think about helping someone get to treatment, I think of we think about enabling, we think about tough love, we think about these interventions. I mean, there's even a TV show for a while on interventions. I never watched it, but I know that it was a big thing, how we do these interventions. And then also this idea that we can't do it we don't become recover we don't get into recovery treatment, become sober for other people. We do it for ourselves. So how do you help a family understand the appropriate place to enter into this conversation or this dynamic around trying to help a loved one into treatment?
mhm. Yeah, and you bring up some really great words that I'd like to address
Please.
as we go on as well, in terms of enabling and tough love and intervention. Because what I find is that a lot of times these family members, these are well-intended terminologies and interventions and strategies. It's just that they are interpreting them in a way where it becomes counterproductive. And for example, enabling is not a curse word, right? It comes from a place of love if you really think about it. And I'd like to come back to that as well. But I also want to address your preliminary question of where the families come into play. And so what I find in, for example, you mentioned those interventions where the family unit comes together and addresses that person and sort of their needs and what they need to do basically to get help and make changes. What I find a lot though as well is a lot of upfront work is critically important working with the family. And I'm talking about when I talk about family, at least when I refer to it in my book, I talk about the primary support system. So you have a whole conglomerate of family members and there's different levels. There's secondary family members or support network. These could be friends that aren't really intimately involved. And then there's a primary support system. And primary support system are those more intimate people involved. These could usually typically be family members, parents, spouses, grandparents, kids, if of course, if they're of adult age. And so that's what I try to focus on. And I tell people all the time is that that's where a lot of people struggle, is because getting them into some type of formal treatment, your loved one, is sort of a very difficult process, not minimizing that at all. And it's very difficult for that person to get there, the family member to get that person in. But on some levels, when we look at the grand scheme of things, that's the easy part. I mean, when you're in treatment, there's a great deal of structure, there's a great deal of routine, accountability. You are eating well, better at least, you're sleeping, there's staff members that supervise you. But it's once they leave that level of formal treatment where a great deal of struggle can take place. And if that family unit to which they're going to enter hasn't evolved or changed or grown in their own recovery process, the chances of long-term success are greatly diminished. And so when I talk about intervention, for me, family crisis intervention, it is working a lot with those family units to create a unified vision, to really establish what their values and needs are, and what are they willing to do to maintain this process throughout the lifetime of themselves or their loved one. And that's where I sort of work with, because a lot of times it frays where people are really into the recovery process. And as time goes on, and I really work on breaking up the process and what every individual family member's responsibilities are. And so, for example, if I may, if there's a family of five, I like to use a lot of metaphors, and I like to use a rowboat as a metaphor. And so in that rowboat, are the most intimate family members. That could be a spouse and parents. And those are the people that will be involved more intimately. These are the decision makers in this recovery process. Of course, you have a fleet of people that are surrounding them, but in this early recovery process, maybe up to a year or so, those are the most intimate people. And I tell people, to say there's a boat of five people, I tell them, if you are still invested in this process, that you have to, moving forward, no matter what happened, assume 20% responsibility and work 100% on that 20%. Is because everyone has contributed in some form or fashion, in a good way and not so a good way. And so that's the most critical piece of what I work with, is that most intimate family system. Because if that phrase, and that they have different visions, or they start to not hold boundaries, then the whole process begins to founder, so to speak. And so that's how I view the families. It's an all hands deck approach, because if they're not going to be involved in that boat, I tell them this is not the right time for you. We need those people who are going to, and that's including your loved one who's struggling, is they have to identify, for example, five of them, 20% of responsibility, and they have to work 100% on their level of responsibility.
That's really helpful, because I think we start to over respond, or we throw our hands up in the air, and we want to get out of the boat. and I think that's, I shared with you that I have a close family member who has been struggling back and forth for a number of years. And one of the challenging parts is, things are going well for a while, and then there will sort of be a imminent crises, and then things sort of go back to normal. And so there is some fatigue that comes from this chronic sort of stress that is permeating. And I think sometimes, we want to see the individual do well. And so it's like you watch this person and, they seem to be doing fine. But then the cycle sort of continues. And so I think it can be challenging to know, and this is what I love the book and the work that you do. Obviously, this helps us make the decision of now it's time to become more invested. It's time to get in the boat, maybe. Is that kind of the way that looks?
Yeah. And I'm glad you bring up the boat as well. It's because you bring up a great analogy. And what I find with the metaphor of a boat when families come into treatment is, let's say you have the five people on the boat, and the person struggling stops rowing. So if you've ever rowed a boat before, how do you gain the most speed and distance? That everyone is doing their part. They're working 100%. Does that mean everyone on that boat is equally skilled, equally athletic? No. But the important part is that they're on the same page and they're working 100% on their shared responsibilities. And what happens a lot with these family members, when I use this analogy for them, is they have five of the people on the boat. The loved one struggling is not rowing. They're just sitting there. And all of a sudden you have four people rowing the boat. And then maybe they have another family member, like a sibling, saying, hey, forget this. I'm done. I'm tired. I got my own life. And then you have maybe two parents rowing the boat for everybody. And then one of the parents says, I'm exhausted. I'm tired. And then you have one of these parents rowing the boat all by themselves. And that's sort of an analogy that I use where it's that concept starts to really crystallize for a lot of family members. Yeah, I've been rowing the boat, or we've been rowing the boat for this long, and we're done too. And so it's about getting everyone to get back on and knowing their part. But to answer your question, can you reiterate your question again?
Yeah, I mean, I was just thinking about how do we know when it's time to regroup? Like, how do we um, decide, like, okay, we've sort of fallen off. A lot of us stopped rowing and we've sort of let things just sort of drift. And we see that the cycle is sort of continuing or starting again. How do you get reinvigorated and get remotivated to get back in the boat, start the process again, keep going, and get a different outcome?
Yeah, yeah. That word that you use, the reinvigorated, remotivated, is a really big concept. Is one of the first things I tell people is have hope, because the treatment process really works. And when I mean treatment, it's not necessarily going to a facility and so forth. I'm talking more in general a recovery process. A recovery just means that everyone is. We all have a form of recovery because we all have some form of struggle. It's just a plan in place for healthier living. And so when I refer to treatment, it could be interchangeable with the recovery concept, but it's just this process of healthy living. It just so happens that many times with the population I work with their chronic or long-lasting struggles, they need some type of formal treatment to get better into a baseline of healthiness. But I tell families that to have hope. Hope is this optimistic belief that something good can happen, and that's it. For families to do that, if they're still invested, if they still believe, if they still want to help get their loved one back, if they're all together as a unit, that is where the really core is of we're not ready to give up hope. It's a fight, and we're not ready to put down that when I talk about that rope, that we still have a chance. And that's where I really want to tell people is that there is still hope. I've seen the most challenging cases where people attempted to take their life 48 hours before entering treatment. They've overdosed on drugs. They were psychotic, hearing voices from excessive meth use, and they're able to get back on a path of recovery. And I say the treatment works, however, as long as everyone's doing their part. Okay, that's the critical component, is that sometimes we correlate that the more damage or hurt someone's caused, the more work they have to put in to for the whole family unit or for themselves. And I said that is one very, very challenging concept, is because when someone feels like they're the only one doing the work because the most damaged, they're going to start to feel helpless and hopeless, and then they're going to give up. And so everyone, that's where that all hands deck approach is everyone has to pick up that oar. Everyone has to work 100% if they're still invested and have hope that change can happen. And that's what I'm hoping I do, is tell family members, we just have to change the strategies. We just have to look at things different and redefine how we've been looking at things all along.
Mm.
And you bring up a great concept too, is that people they get into treatment or recovery and they're doing well, and all of a sudden they slip after over some time. And there are three words that I use for people when I ask family members, why can your loved one continue to struggle? Why can he or she continue to relapse? Why can your grandchild continue to go to treatment for 30 days and leave and relapse and come back home? I ask audience members three words of why that is. Do you mind sharing what you believe those three words may be?
Well, they guilt,
Mm-hmm.
shame, and perhaps they feel hopeless.
Mm-hmm. Very, very true. Those are very, very accurate. And whenever I ask this question, people give a lot of true and valid answers to relieve pain, to escape trauma. All of those are very correct. But I say it on a more broadband level, the reason why loved ones can continue to struggle is because they can, is because on some form or fashion, someone or someones are co-signing that it's okay to continue to struggle. So for example, if a loved one loses 5 jobs in 1 year due to not taking their medication if needed for depression, or they're chronically smoking excessive amounts of marijuana and they're missing shifts at work and they get let go, and we continue to supply them money, we continue to provide them resources, where's the real motivation to change and to sustain change? Right. If you have, I see this a lot, family dynamic where, okay, well, gosh, I have these young kids, and one of the parents are estranged from them, and we want, the parent to be in our children's lives, although we know they're using substances and not really managing their mental health. Where's the motivation to change if they can still engage in that unhealthy lifestyle and still be part of the family? And and that's what I work with families, is identifying what I call leverages, right? And so many times I've seen people, when they set those boundaries and leverages, they're forcing that person to make a decision, right? We're not kicking anyone out of the house, so to speak. We're telling them, hey, you can more than welcome to stay here, or more than welcome to support you, but we're just not willing to support this unhealthy lifestyle any longer. So sometimes people think like, Dr. Brian, my God, how can you kick someone out? So we're not kicking anybody out. We're just telling them what the options are on the table, what we're willing to support, because the longer we support this unhealthy lifestyle, we're doing more harm than good. Mm-hmm. We're inviting harm and danger to the family, and we are worsening, exacerbating their unhealthiness. The longer they stay in that state of being, and the longer someone stays in that level of unhealthiness, they get comfortable and they invite more potential harmfulness and danger into their lives and also the family's lives. So, yeah.
Yeah, it's a super fascinating conversation, because I think that this idea of enabling or tough love, like we talked about before, but this tough love idea feels like I'm removing all support. Mm-hmm. And you're on your own until you follow my rules. And what I think you're saying, Dr. Brian, which is so helpful, is that there are healthy boundaries. Mm-hmm. And there's healthy ways to communicate those boundaries. Yeah. And there's leverage around the support you can offer, but there also needs to be a understanding of this dynamic. And I think what I've noticed is that that sounds great. But then we get into the rowboat, and this person says, well, my boundary is this. And this person says, well, I'm willing to do this. And this person says, yeah, but that doesn't feel good to me. So I would imagine that part of the work that you do and what your book mm-hmm. helps is to bring everybody onto the same page.
Yes. I call it, there's a step, the step-by-step, and one of them is called cement the unified vision. Mm-hmm. And cement the unified vision. It means we have to come up, and doesn't mean we agree with everything, but we are validating one another that this is what we're willing to support and be a part of. And you have to cement that vision. And so that's what I work with a lot of family members, is we have to be on some unified front. Because if we're not, as you know, that's where it's going to fray. Young kids. I have 2 young kids, and they would. That's part of our natural human condition. Is when we don't get one thing from one person, then we're going to try to get it from another person. We call that splitting, right? That's what we do.
Mom told me I could.
Mom told me I could. We do that all the time, and that is no different of a concept when it comes to a struggling loved one, right? That's what we do. Is we want relief. We want to get that what we want and desire, and to be reinforced, whatever that thing may be. And so that's where that family unit has to be very, very unified. It's critically important. That's what I mean by a lot of the upfront work is critical with the family unit before they even get to treatment, before we ever do that intervention with them involved. And that's the first thing when someone is in formal treatment. That is what I work with first, is the family unit, because the person's in there, and I have faith in the process that they're going to do with their things, and the treatment process is going to help that. But my focus intervention is working with that family, is I tell them is that we need to create a very, very solid vision in what we're going to be a part of. And I outline that all the way up to 1 year. I divide up what I call the phases of the recovery process. And what do you expect in the first 30 to 90 days, which a lot of the fraying takes place, the relapse, the family units give in. People go back home right after they're in an inpatient facility, and they go back to their same life. And I talk about 3 months to 1 year, which is phase two. Phase three is 1 to 2 years. Phase four is 2 years plus. And it's a lifelong process and sort of what to expect on a client level or individual level for the person struggling, and on the family level. What are some of the biggest challenges and what to expect in the process? And so I find a lot of that because you get a lot of family members like, oh my gosh, my daughter's been sober for 3 months from alcohol. Why does she still have dreams of drinking? Or my son, he's taking antidepressant medication, but he's been taking it for 1 year. Why does he still have some fleeting thoughts of harming himself? Very, very valid. And so that's where I came up with this phase of recovery process to really outline what is expected in this process. And if someone can make 1 year mark, not to say that on day 366, it's finished and over, it's a lifelong process, but it looks different than phase one. And people can start to, what the family unit, what they can do on their end to get their life back, what the individual's responsibilities are to maintain that recovery process. So the whole unit moves together throughout this lifelong process. But it gets easier over time as things become more automatic and person gets healthier. And so
I love that, because I think that we can get caught up in why isn't it done yet, and how long is this going to take, and to just understand from the get-go that, let's take a year and let's really focus and hone in, and then we've got some other things that happen at that 1 year mark. But I think it's helpful to just set sort of the stage so that people don't think that 30 days and we're done. And this is because I work with people who are, at different levels of addiction with alcohol. Some of my clients have been in treatment or go to an intensive outpatient, or they do a 30 days. And then exactly what you said, Dr. Brian, they come back into this environment, and it's great for them when they're away because it's all taken care of. They're not drinking, obviously. They're getting a lot of support. They're often getting daily therapy. They're maybe getting a regimen of medication. They're getting outside. They don't have the stress of job and family. And then they come right back into that environment. And like you said, if there isn't a structure in place, it's really challenging, because we don't fix our problems by going away and then coming. We don't solve them all in that 30 days, right? And so, it really is helpful to understand that that's just the beginning and not the end.
Just the beginning. And I call phase one the equivalent of the intensive care unit. So if any of your listeners, you've been in the intensive care unit, or you know someone, it's the wing of the hospital setting where something bad has happened, right? You've suffered a stroke, you've suffered a heart attack, you have to be intubated, you got in a car accident, or you made a suicide attempt or something, where the intensive care unit means survival is the biggest thing. And people don't realize, for example, I like to use an analogy of a stroke because I think a lot of people can relate to that. Someone has a stroke and then the intensive care unit, once you get discharged from the intensive care unit, you don't go back home and go to the gym full time. You don't start traveling and go back to work in the same level. No, you have to have a step down level of care, whether, depending, of course, the level of stroke that someone experienced, whether it be speech rehabilitation, neurological rehabilitation, for some people to be able to walk again, and so forth. So varying degrees. But my point being is there's a step down level of care to maximize the long-term success, right? And so that's what I tell people, is that if you're in the hospital because you've attempted at your life, or you were hallucinating or delusional, right? People think, okay, I'm there for that many times, I just go back to my way of living. And that's where I see a lot of people in the mental health arena. No, there has to be a step down level of care where there might have to be 30, 60, 90 more days where you start to stabilize, start to sleep better, have the medication, get a more accurate diagnosis. And that's where that phase of recovery process looks at, where family members can see the whole blueprint or the map of, okay, this is what's going to look like. And I also talk about that a concept of the difference between a relapse and a lapse. And a relapse is typically a big fall. A lapse is a slip. And a lot of family members like, oh my God, this was such a waste of time. We spent so much money and time in therapy. In 30 days, we've been here. And all of a sudden, he or she drank a bottle of alcohol. Well, I said, okay, well, is it a relapse or a lapse? Okay, well, what happened? Well, they broke up and they're having a lot of financial distress. But prior to treatment, what would happen? Well, they would drink a bottle of alcohol, then they would transition to heroin, they would be homeless, they would be psychotic, and maybe they would attempt their life. Okay, well, what happened now? Well, the person lapsed on a bottle of alcohol, but he or she realized, okay, I made a wrong step. I'm going to go back to my therapy group, talk to my therapist, come clean. I have these coping mechanisms and get back on track. And so that's where I talk about with a lot of families is because just because someone makes a slip doesn't mean that everything was a failure and to lose all hope. And I'm not giving everyone permission out there to say, okay, Dr. Brian's giving me permission to slip. No, of course not. We want a person to be on a healthy path forever, but there's a difference between a slip and a major fall. And someone has a stronger recovery program will learn how did we get here and how do we prevent that moving forward.
Yeah, I think that's really helpful. Thank you for that because we create so much meaning out of these circumstances. And sometimes we can just say, okay, brain, like we can let that go and we can see it as an opportunity to learn. We call it data points. Sometimes, you have data point because you're getting information.
Yeah.
So it's more helpful. So I have a question for you I know we just have a little bit of time left, but, some of the people that I work with have been that person who is in crises and their family has come to them and said, we're doing an intervention, the kids are worried, the spouse is worried, we want you to go to rehab. And how does the individual process that place of allowing that people meanwhile want to help, but maybe they're feeling like maybe they feel like they can handle it without rehab. Maybe this is sort of the knock on the door, like, hey, it's time to do something. So if we're looking at it from the individual standpoint, how can they be more open to accepting help, understanding they don't maybe have to feel shame or feel like betrayal from people coming in to help them and intervene?
Yeah. And another great concept and question that you're bringing up and where my interventions come into play is when the family unit has tried everything. They've tried partnering, collaboration, they've tried tough love, assertive love, which I call it. Have stringent boundaries and more loose boundaries. They've empathized, they sympathize in everything. That's what I'd say. They believe they've tried everything. And this is sort of the last resort, whether or not they get them into treatment. So I just want to upfront that as well, is that the family members, when they feel helpless, to know that they felt like they've tried everything and nothing is working. And so one of the things I talk about with people is sometimes family members, there's three things when we're faced with a challenging event. You either fight it, like for example, in treatment, hey, I'm going to take this on. I want to get healthy, sober. Where you freeze, right, is that I don't know what to do. I'm put in a situation, or I'm going to take flight. I'm going to avoid the situation. The first two are very, very powerful concepts because, of course, if you want to fight, that's great. And then the process can begin. When people freeze, they don't know what to do. And usually when people are freeze, they're vulnerable and open to direction. But when people take flight, and flight means, I look at it as another metaphor, is they still have gas in the tank. But sometimes people think that when someone wants to get healthy and sober or get a path in recovery is that they have to be willing. Their bags packed. I'm here. I'm ready to go. That's great, but not really all the time. And I talk about that willpower is, I believe, only about 50% of the process. That willpower to white knuckle it, I'm going to do this. That's huge and great. But sometimes people think that's all it takes, that person has to just be completely willing. But it's very true. The person has to do it for themselves. But what happens is the family unit or the family system or whoever's in that system of support, they can lead them to a point where a level of what I call desperation, right? Not rock bottom. Rock bottom is well meaning again, but a lot of times people don't know what rock bottom is. But you put them in a level of desperation where their only option is to get help. And so, and I also talk about planting the emotional seeds. And that's a great point that you bring up is, well, how does a loved one know or they don't feel hopeless? And what you do is you continue to remind them, whether it become in the form of a text, whether it become form of an email saying, hey, we're thinking about you. We're hoping you're okay. Once you get ready, when ready to get help, we're here for you. And I had one gentleman particularly that he talked about who was in treatment, and that his mom, his father had passed away, and his mom set a boundary where he wasn't allowed to live with her anymore. But every once in a while, when he's about to get high on heroin, she would send this text: "Hey, I love you, thinking about you, hope you're well, ready here to support you when you're ready." And he said it was the ultimate buzzkill, where he would want to use, and all of a sudden his mom gets a text from his mom. But he realized how that all came together. That it was these, what I call these, planting these emotional seeds, that one day those seeds are going to sprout when that person has a level of insight, awareness, or clarity. And so, yes, that's where assertive love is this balance between rules and relationship. It's not that tough love, because a lot of times when we say tough love, people can misinterpret that as tough luck. We're done with you. We don't want nothing to do with you. Get better first before we want to have anything to do with you. And imagine someone who is chronically depressed, suicidal, under the influence, they're going to give up hope. But if they know that there's a family system out there and there's an option for me, that if I want to be a part of that, I want my loved ones back in my life, there's a part that I need to do, that I need to get on track with. And so realizing, accepting that sometimes they just have gas in their tank, they haven't reached that level of desperation, is critically important to realize. And that's where I work with the families. We have to shut down all the options, because they can means they have options out there. And so that's what I work with families, is we have to shut down all of those options, where the only option left on the table is getting better and getting help.
Oh, yeah, that's super helpful. Well, I love the idea of rules in relationship. I think that's such a powerful concept. So, Dr. Brian, tell us where people who are looking for this kind of support, how can they work with you? Tell us where to find your book, and tell us all of the things so that people can get this resource.
Sure. Well, my book is available on Amazon, Barnes and Nobles, and about 13 other distributors so far. But Amazon and Barnes and Nobles are probably your best place to access it. You can also look me up on my website, drbrianlicuanan.com. And for there, some of my has the book there. The excerpts of my book is there, and I have links to Amazon and Barnes and Nobles, and a little bit about my work and some of my other media appearances and so forth. And so I'm assuming you'll put my website URL handle probably somewhere there, so I don't have to spell it
And
out.
do you work with individuals, or is it like difficult to get into to your stage, which is where the book comes in handy? Like, not everybody can see you in person. Not every family is available to come and work with you one-on-one. But do you do that type of work as well?
I most of my work that I do on a private practice level is more of the family crisis intervention part, where family members will come on Zoom, and we come together and we find out what their needs are, what the leverages are, go through the step-by-step plan. So that's usually at the level of work that I do with a family unit, rather than more on the individual level struggling. And so, so that's kind of what I do. And the book is a first step in helping them, but people are more than welcome to reach out to me if they need more specific details or specific recommendations on their specific family needs.
Well, I love that this resource is out there, and I think it's going to be a really unique offer in this space of recovery and
Thank you.
Wellness. And so thank you for your time today. It's been delightful.
Thank you so much, Terry.
I want to thank you for tuning in to the Sober Edge podcast. This is a place for important conversations and a safe place to question everything you thought you knew about drinking. If you're looking for your sober edge, I want to invite you to connect with me at thesobernutritionist.com, where you can grab my free resource, Becoming More, a guide to loving your sober life. And I would be so grateful if you enjoyed this podcast, if you would leave a rating and review, as it will help more people find their sober edge.